When we started, we did 4 infusions that first month, and that was very scary. It just all depends what the demand is in your community for this treatment. But I think as a practice, it's just better to assume it's going to be slow and just be okay with it. Accept, surrender to that. That is the reality. But have faith that continuing to do these practices, to continue to work on your marketing material, use that time when it's slow to work on the business, because eventually, if you lay that great foundation, you will be busy.
3, 2, 1. Lift off.
Welcome to the Ketamine Startup Podcast. I'm Kimberly Chan Ko, and along with my co-host and partner, Sam Ko, we're 2 physicians who run a ketamine infusion clinic in Palm Springs, California. Beyond our own clinic, we've had the privilege of helping doctors and other licensed medical professionals across the U.S. open their own ketamine therapy clinics. On this podcast, we share the realities of starting and running a ketamine infusion clinic, marketing it, and more. This episode comes straight from one of our mastermind sessions with our course students, where we talk about the 13 best practices for ketamine therapy clinic. We had a great time revisiting these best practices, and we hope you find this session insightful and helpful as you navigate your own journey. Let's dive in.
Number 1, have a staff member in the room at all times during the infusions. We recommend this because ketamine creates non-ordinary states of consciousness. It can be kind of intense for patients, especially if they've never had any entheogenic, psychedelic types of experiences. So we suggest having someone, and at our clinic, either it's me, my nurse, my medical assistant, who's BLS, ACLS certified. So someone is always in the room observing the patient. We think that's the safest way because, again, the patients are entering quite a vulnerable space and they may be going through some challenging times. I know some clinics will have like a call button or a video camera, which is fine and doable. But I think that having someone there who's immediately available can be really nice, because if, let's say that, there is no one there and there's a call button, sometimes the delay of the call button can feel like hours for a patient while they're in the infusion. And so I've heard of other patients who go to a different clinic and they'll push the call button, but then they mention, oh yeah, I felt like, 30 minutes before someone had come to check in on me. So we think having someone there literally, several feet away is really important because, it helps the patient feel safe. And that's one of the important things that I've noticed for the ketamine therapy is when they feel safe, that they're supported biologically, physiologically, then that allows their mind to be even free to go wherever it needs to go to get that inner healing, to go to places that they may be scared of going. So having someone present at all times, we think is one of the best practices. And that's the reason why we put it number 1.
And we're all about set and setting, and have a staff member, a person in the room is part of that setting. And I just want to echo what Sam has said. We've had many patients that have come from other clinics where they don't have a person physically in the room holding space. It can be emotional space plus monitoring vital signs. And they did not have that. And then they come to us and they are amazed by what a profoundly different experience it is. So if you're thinking also from a, differentiation, how do I set myself apart from the competition? This is a way that you could do it. So even from like a business standpoint, but also just from, what would you want if you were in that position, if you were a patient in a vulnerable space? Number 2 is review medical records prior to treatments.
This is really important because sometimes patients, they don't know their own medical history. So for example, when I used to work in the ER, I would ask a patient, hey, what medical problems do you have? And they say, oh, nothing. I'm, fine, healthy as a horse. And then I'll go look at their, epic medical chart. And turns out they've had coronary artery bypass graft surgery ×4 cabbage. They have history of AFib. They're on blood thinners. And the patient, for some reason, they don't know. And so we think it's really important to review those medical records. And it's nice because if you're not a psychiatrist and maybe you're not putting in these diagnoses of various mood disorders, you can confirm that they have, major depressive disorder or generalized anxiety disorder or complex regional pain syndrome. So it's nice to have that confirmation. There was actually a time when this, came in very useful. I was consulting for a patient who was considering IV ketamine therapy. And again, talking with him, he seemed like a good candidate. And I was like, well, let's review the medical records. That's something we do prior to scheduling you. And in that medical record review, I found out his hemoglobin was like 7.2. So hematocrit like 21. And so he was very anemic. And I said, hey, before we begin the IV ketamine therapy, why don't you, get this anemia workup completed? And so he's like, oh yeah, I totally forgot to mention, my hemoglobin. My doctor mentioned it, but we didn't really discuss it. He started getting workup, colonoscopy, iron studies, etc. And this is kind of sad, but about a month later, after I consulted with him, turns out he passed away. He had some sort of cerebral hemorrhagic stroke. And I don't know if it's related to the anemia or the workup or whatever. So again, reviewing those medical records prior to the treatments, the labs, the diagnoses, the medication list, the vital signs, the EKG, all of these can be incredibly useful to have prior to treating the patients.
And some patients haven't had somebody review their medical records either. We're surprised by how patients are like, oh yeah, I did have that happen. Or, oh, my doctor who ordered that never told me that was what happened. Like, we already know the healthcare system is overtaxed and the folks that are in it are way burnt out and are busy. So this is just providing more value to the patient. Now, I do want to acknowledge this does cause a longer time between when you get a patient to come to your clinic or decide that, yes, I think we should go start the process of you becoming one of our patients. There is going to be that time from making that decision to reviewing it to then actually having the patient come into your clinic. And this is another thing that varies from clinic to clinic, that they don't necessarily request the review of medical records. They'll do their own history and then make decisions whether to start a treatment or not, because that reviewing medical records does create lag time. You have to have them sign the medical records release. Then you got to contact the clinic where they're, got the release signed, blah, blah, blah. It does create a lag time, but we find that the value and the service that we're providing, plus also we believe it's good practice to do, outweighs that need to get the person into our clinic and start the treatment. It's just one of those things that we feel pretty passionate about. And that's why it's number 2.
Number 3, have emergency protocols in place and know how to handle these acute issues. Now, it's not going to happen frequently. 98% of the time, everything is going to go easy peasy, lemon squeezy. But there will be times when emergencies do occur. And most likely, if you do this work long enough, you will be calling 911. It might be due to chest pain. It might be due to AFib with RVR. It may be due to a seizure. It may be due to acute suicidal ideation with a plan. So these are various reasons that I've personally had to call 911. And it's rare, but it does occur, meaning you want to have the protocols written down in place and then practice the emergency protocols. Meaning when you have a little bit of free time, or even scheduling it into the calendar, maybe once a quarter, where you review the emergency protocols with your staff. Literally do like a mock scenario, like a code blue type of scenario, because practicing it can make it easier for the staff. Now, if you're already in the emergency department and you have that experience, or you're an anesthesiologist, or you're comfortable with that, that's great. And it's almost instinctual for you. But your staff may not be familiar with that. And we've had one time where we did call 911 for a patient. And
The first time.
And the staff member, when they called 911, they actually gave them their own personal address when they were like, hey, where should we, send the paramedics to? They gave them their own address because for some reason they just got into like this fight or flight moment and they forgot the address. So I think practicing it is really important on a fairly regular basis, once a quarter or so roughly. And that way that when it does occur, not if, but when, everyone will be prepared.
And there's something about having that protocol or having that game plan for you and your staff in place. It's almost like it's this talisman to ward off it happening. Like when I was doing cataract surgery, if I pulled out all this extra things, if the cataract surgery, which is one of those most routine, straightforward surgeries you can do, and most of the time goes super easy, but sometimes it doesn't. And if I pulled out everything I need just in case it went south or went in a direction I didn't want, it seemed to be fine. I would never need to use it. But when I didn't do it, the one time I'm like, we're good. then I would need it and I'd have to call the scrub nurse to like go get the circulator, would have to go grab whatever extra instruments or that 1009, just suture the cornea or whatever. There's something about just knowing that you have this whole thing in place. And I just want to echo what Sam says. If you're already knowing how to run codes, you know how to save the lives, you're that ER doc, anesthesia doc, you deal with this on a day-to-day basis. That's great. It's your staff member. It's your staff, your medical assistant, your nurse, your paramedic maybe, or whoever it may be that just, they weren't expecting it. And that's what really was a profound reason for us to work this number 3 was that we saw how unprepared they were, or how, I don't want to say unprepared, but they just weren't used to that type of experience. And since then, we do quarterly mock emergency protocols. Plus, whenever we have a new staff member join, we make sure to do it earlier so they are very aware. Moving on to number 4, recommend preparation for patients prior to infusions.
This preparation is really crucial for the experience. One of the metaphors I use is like if someone is planting a garden or they want to start growing some vegetables or flowers, well, before you start the planting, you want to prepare the ground, i.e. get the weeds out, maybe move some of those big rocks, till the soil, put in some fertilizer, etc. And in a way, the ketamine journey is kind of like planting a new garden. And preparation for the patients is really crucial. And it'll help differentiate your clinic from other clinics who may not have that. So some of these preparation guidelines, you may be recommending 5 days or 7 days before the actual first session, and includes things like journaling, meditating, being in nature, avoiding news, social media, eating healthier, exercising, etc. So all of these kind of lifestyle practices that can add to the ketamine therapy, because we know that IV ketamine is robust, but it's not a panacea. It's not going to cure everything. So having the patient start putting these things into practice before the ketamine and even during the ketamine series of 6 infusions, where they'll be able to incorporate these practices into their life, can make a really big impact. Ketamine seems to be a catalyst. So as they're putting in these new practices, it'll get further cemented because we're creating new neural grooves and pathways. And so as they're changing their actions, the ketamine seems to be solidifying those actions post-infusion. So by doing it before, that even adds extra. Now, I do want to mention that some patients may not be able to prepare and do everything perfectly. And we tell our patients, it's okay, just do your best. Start doing a little bit every day for this preparation, knowing that as they start getting the ketamine treatments, it'll become easier and smoother for them.
And having them prepare, not just medically prepare, like, no eating before the treatment type of thing. It's really encouraging them to, there's a certain amount of like ownership in their lifestyle outside of the medication itself to help support that catalyst for change. Because some patients, or even just the current health model is the cure is in the pill. I take the pill, I feel better. The medication is going to help me. Oh, I just need to get the ketamine and I'll be fine. Where we're already kind of planting that seed in their mind of, there's some personal ownership, some action that I can take that can help support me in this treatment. And then that even translates to actions after the treatment, which I think brings us nicely to number 5 is create an integration plan after the infusion. And Sam started to mention that about that catalyst, that taking those little changes in between.
Yeah. So, going back to this garden metaphor, I would say the integration is like cultivating the plants post seed, and i.e. giving it water, making sure it has enough sunlight, protecting it from the bugs and insects. So it's literally like once the patient has completed their ketamine infusion and, each session, having them come up with some tangible action that is going to make an impact. And it may be further incorporating some of those things that we had mentioned about preparation. It may be adding meditation to their practice. It may be adding gratitude. It may be adding journaling. It may be adding an appointment with their psychotherapist or integration coach. But knowing that, yes, the ketamine is one tool and we're going to supplement it with all these other tools. I think about, if someone's building a house, you're going to want a plumber, an electrician, someone who can paint, someone who can do drywall. And so ketamine can be quite effective and do a robust job, but having these additional integration actions and plan after can be incredibly beneficial for the patient. One of the things I've noticed is that the patients who do make these changes, they actually get quite longer, robust benefits. And so we're to the point where I've had patients who've made some of these integration changes in their life, and I don't see them for 6 months, a year, and they're, after the initial six, and they're like, oh no, hey, Dr. Co, I'm actually really good. I've started doing, yoga every day, or I've started meditating every day, and I've started, I'm swimming, 10 to 20 laps. And what I've noticed is those patients who actually do something, integrate the experience into their daily life, they seem to get more benefits from IV ketamine.
What there's a way that you ask the patient at the end. That's something about the extraordinary to the ordinary. There's a turn of phrase that you do. I love when I've heard you say it.
Yeah, I tell the patients, having the ordinary experience and taking the extraordinary and bringing it back into the ordinary reality of life. I ask my patients this question, having this experience, what's one gemstone? What's one thread? What's one thing you can pull back from the experience to bring it home to your daily life? And I find that patients like that approach. And again, this is something that you can do for your patients, which may differentiate you from the other clinics who just do, treat and street type of model where they're like, yep, here's the ketamine, good luck, peace. But if you actually talk with them and support them for this integration, that's really going to differentiate you from other clinics that may be in your town.
Which brings us to number 6, is to create a network of therapists, psychiatrists, and coaches. And this is especially true if you're not a psychiatrist or you don't have that network already, because this goes hand in hand with number 5, creating that integration plan. Part of that integration may be breaking down what was experienced and really having a good understanding, or it was challenging, it was scary, it brought up some stuff that was suppressed and pressed so down so deeply, and now they're revisiting something they had forgotten. And whether you do it in-house or whether you have it a network, there needs to be that support net and already having that in place. And so therefore, if you are not a therapist, psychiatrist, or have in-house coaches, creating one works. Now, not only is this good for your patient, and I believe this should be not only a best practice, but it needs to be part of like the standard protocol. Like there is going to be somebody that patient can talk to with, but it's also good for business. Creating that network of therapists, psychiatrists, and coaches allows those around you to know that you exist and you can work collaboratively.
Yeah. And I love this because, when you do connect with this network, and here's the way I would actually do it. Here's the tangible action is I would go on Google, look up the local psychologists, therapists, psychiatrists, et cetera, and give them a call and say, hey, we're opening up a ketamine clinic. I'd love to share some more information with you, connect with you. And that way you'll know and you'll get a sense after that phone call. Maybe some people may not be open to IV ketamine. And so you're not going to put them on the list in your network. But some people may be really interested and fascinated. And then you can share more information and put them on the list of like a referral list. And that's what we do at our clinic. I have literally a PDF, all the local psychiatrists, therapists, psychologists, coaches that I've connected with. And I'm like, yeah, they have a good vibe. They have a good energy. I've talked with them. They're really easy to communicate with. They seem like a good person that I can refer patients to. And so the tangible action is actually make some phone calls and see who can fit with your clinic style.
If you tuned in to our episode today, chances are you're curious about the ins and outs of starting up a ketamine clinic. It's an exciting field, but let's face it, the journey from idea to actually opening day can be quite daunting. That's why we've created something special for you. Think of it as your personal roadmap, a free downloadable checklist that lays out the essential steps you need to consider when starting up your ketamine clinic. This checklist is designed to help you avoid common pitfalls and launch your trajectory to success. So how can you get your hands on this checklist? Simple. Just visit www.ketaminestartup.com/checklist and grab your free copy today. We've made it easy and accessible because we believe in supporting our community with a valuable resource. ketaminestartup.com/checklist. All right, let's get back to our discussion. Stay tuned and don't forget to download your free checklist during or after the podcast.
Number 7 is be patient as you start. Since the clinic can take time to build, we're in a day that more people know about ketamine, for better or worse, depending on what's going on in the media, what celebrity has mentioned something and whatnot. But it can be slow. When we started, we did 4 infusions that first month, and that was very scary. It just all depends whether, what the demand is in your medical community and your patient community for this treatment. But I think as a practice, it's just better to assume it's going to be slow and just be okay with it. Accept, surrender to that is the reality, but have faith that continuing to do these other practices, to continue to work on your marketing material, use that time when it's slow to work on the business, work on these other aspects, because eventually, if you lay that great foundation, you will be busy.
Yeah. And when it is slower, because I would expect that, as Kim had mentioned, then that'll actually help you streamline the process, right? If it gets way too busy your first month that you're open, it's kind of overwhelming. You're like, oh man, I'm like juggling 20 different things. But when it's 1, maybe 2, maybe 3 patients, when you first start, you're like, okay, we actually need to remove this step in the process, or we need to add this, or hey, we need to get this extra thing. So having that is really crucial.
Going back to what Sam was saying, using that time when it's slow to streamline your processes, it's actually a blessing in disguise when it's slow. And most of you are going to be cash-based practices, maybe doing super bills, but not reliant on insurances. And so understanding and just being used to that, there is going to be ebbs and flows. There are going to be seasons of famine and there's going to be seasons of plenty. It's just, that is just kind of the nature of this. And so think of these slow times as a gift for you to look at some other areas.
Now, as you start seeing the patients for those initial 6, the initiation series, then they'll be coming back, some of them for maintenance boosters, which might be once every 1 month, 2 months, 3 months, maybe even 6 months or a year. So be patient. But what's nice is as you continue growing on this process and your clinic starts growing, those patients will be coming in back for maintenance boosters. And there's one thing that I want to mention. It's called the Lindy effect, Lindy effect. And one of the things about that concept is the Lindy effect means basically that the longer something has existed, the more likely it will be existing. So, we've been open here for 5, actually 6 years now. And so we know that because, something has been around for 6 years, that it's more likely than not to be longer for, double that. So if you think about these old companies, like, for example, I don't know, like Liberty Mutual, like an insurance company, for example, like they've been around for hundreds of years and they're going to continue being around. So there is a benefit, like being patient, playing the long game is really important for your practice.
Number 8, be meticulous about keeping track of scheduled substances.
And we know that ketamine is a Schedule 3 substance. So every time you receive a package of ketamine, you want to make sure to log that. Every milliliter of ketamine that you use, you want to log that and be really on the up and up. Because again, if the DEA or some medical board or whoever comes and looks over your shoulders, you can say, hey, here's our ketamine logs, here's our midazolam logs, here's our, propofol logs, or whatever controlled substances that you may be using, that you can be really meticulous with the record keeping. And the more that happens, you're more confident and you're more sure that, hey, we're doing the right thing. And because there is kind of with ketamine, although for us it may be more mainstream, for other people it may not be. And as a result, we want to keep everything above ground, in the light, shining bright. And one of the ways to do that is being very, very conscious and meticulous about keeping track of those controlled substances.
Number 9 is monitor all patients' vital signs carefully during the infusions. Vital sign monitoring, how much, how often, continuously or not, varies from clinic to clinic. But here at our clinic, we do continuous vital sign monitoring for every single person, anybody who's in the clinic getting a treatment.
Yeah. And we call them vital for a reason, right? They are vital signs. They're important. And keeping track of that is crucial. I know one of the ideas that we have is ketamine does not create respiratory depression. That's kind of like a long-standing rule. And most of the times that is true. It doesn't. But at certain doses and for certain patients, it can create slower respirations, which in turn creates hypoxia. If I wasn't keeping track of their pulse oximetry, then they might, have a drop in their O2 and it would make a difference. When we're in med school residency, I remember my attendings would always ask, "Hey, Sam, if you order that test, will it make a difference?" Right? If you order that CBC, CMP, troponin, BNP, et cetera, like, is it going to make a difference and impact? So applying that same question to the vital signs, would a vital sign make a difference in the treatment of patients? So for example, if someone's BP shoots up to 220 over 120, right? And they were normal before you started, is that going to make a difference in the way you treat them? Yes, of course. You might add a little bit of IV labetalol, or you may even pause the infusion. So if their O2 drops, is that going to make an impact? Yeah, you might put a little nasal cannula oxygen. If they go into AFib with RVR, is that going to make an impact because you've been seeing it on the cardiac rhythm? Will that change what you do? Yes. So to answer the question, yeah, we think it's crucial to keep an eye on the vital signs because it can make an impact. The other nice thing is when I'm watching their vital signs, one of the things I do is I do blood pressure checks every 10, 15 minutes. And it actually is useful to me because when I see their blood pressure go up, I know that the ketamine is going and it's creating a physiological response. And that will allow me to titrate the dose for the subsequent sessions or even add in a little bit ketamine. So because ketamine is a sympathomimetic, I do want it to increase the heart rate a little bit, increase the systolic or diastolic, increase the pulse a little bit. If I do not see those vital sign changes, then I know that I need to add in a little bit more ketamine, either during the infusion or for their subsequent infusion. So it does make an impact. We think it's really crucial. I know some clinics don't keep track of vital signs and there's, they have a rationalization for why. But I think one of the best practices is to do continuous vital sign monitoring and keeping a really close eye on this.
Number 10, keep your overhead as low as possible, especially when you first are starting out. And what's funny is we've interviewed several people on our podcast who, they've started around when we started our clinic or they started before us. All of them, we asked them, what's that one piece of advice you'd give somebody who wants to start their own clinic? And often it is, besides know your why, is start with your lowest overhead as possible, invest as little as you can because of those times that it's very lean and you don't have patients. I think part of the low overhead is you just don't want to be in that position of having to move the meat and having to see patients that you're not prepared yet to see, causing yourself to be in that stressful scenario that you might find yourself already in a busy hospital, having to have, higher RVUs and all that. But now you're in a position where you've created that same scenario for yourself. You're already going to be juggling so much. The last thing you need to do is have this pressure of seeing more patients because your overhead was not low.
Yeah, I think this is really important in that, and it's actually true for any business, whether it's a clinic, an ice cream shop, a pizza restaurant, like having that overhead low is crucial for the long-term success of your clinic. And so for you, what this may mean is you're going to wear a lot of hats, especially at the beginning. When we first started, I was literally cleaning the clinic. I was sweeping and mopping and Swiffering and, dusting and wiping things down. And again, it was slow, so that was fine. And then as we grew bigger, that became outsourced. So know that you may be answering more phone calls. You may be the secretary and the office manager and all these other things. But that's nice because that'll help you keep your overhead low. And it may not be a sudden rush of patients at the beginning, but it's okay because if your overhead's low, it's like, oh yeah, that's all fine. Like not as much pressure as Kim had mentioned.
And when you're wearing all these hats and doing all these things, it actually makes it easier for when you do hire somebody else or outsource it. You know exactly what you want, you know exactly how you like it done. So either when you're training them or you're giving them feedback and knowing if they're doing their job and you're getting your money's worth and that they're providing the service that you've agreed upon, you've already done it. You already knew how you want it in your clinic. So you can even lead better and be a better business person. That's what I learned when we were doing our websites and our marketing and these, more of the less clinical things was since we knew, we built the shelves and, we cleaned the toilets, and we were the ones that handed the clipboard to the patient to walking them all the way through. We had the protocols in place, and we also knew exactly what to set the expectations for our staff. So it's actually a really good practice. And also it really puts you into that position of being like a servant leader, because you've been there and your staff knows you understand where they're coming from. Number 11 is, if you feel uncomfortable about treating a patient, trust your intuition.
Yeah, so this isn't like when I used to work in the emergency department, where I'm required in the ER to see every patient. So we have these EMTALA federal rules where any person who comes into the ER, I must treat them and evaluate them. Now, when you have your own private practice clinic, that's not the case. You can actually choose who you work with. And this is important because some people may not just feel right. Trusting your gut intuition for one reason or another. There may be a reason why you're like, yeah, it just doesn't feel right. And so trusting that, you don't have to treat every single person. If something feels off, I would recommend erring on the side of not treating them. And I've made that mistake where I did treat the patient where it just felt off, and it actually ended up where the patient didn't get really good results and they had no benefits. One of the important things about ketamine is the therapeutic alliance and relationship between the doctor and the patient and the clinician and the client. So if that isn't there and there's just some sort of friction, it may not benefit the patient as greatly as if, there is a good fit, there is a good vibe, there is a good connection, because that's another piece of the ketamine therapy. It's not just the ketamine. It's the relationship. We heal through relationships, and having a strong relationship is important. But if you don't feel right in that gut sense and that intuition, then it may not be as beneficial.
Well, the therapeutic alliance, it's trust, right? That you want the patient to trust you. You also need to trust the patient as well, right? So if your spidey sense is going, something's off, you're not fully trusting them. So you're not doing your side of that trust. This is something that, as much as we tell you this, you will get to experience this yourself. And as much as we teach others this, we continue to get to learn this lesson in a new form, in a new way. But remember, we tell our patients, we encourage them, through their preparation and their integration, about reconnecting with their feelings. Some of the issues that they've faced is because there was this disconnection from the feeling. So if we're telling our patients to learn to trust their intuition, to help them guide what integration they're going to do, or what changes, those little micro changes they can make in our lives, we can do that too. So, I encourage you to not only encourage your patients to do this, but to also encourage yourself as you're doing this, whether it's talking to vendors, whether it's in the patient, whether it's deciding, I don't know if I want to use this web service or this marketing company or whatever it is. Go with your gut, and just, that's just something that we get to continue to learn. Number 12 is, the key to starting is to start by taking one step at a time.
Literally, there's going to be 100 things in your to-do list. You probably may know this already when you're starting up the clinic. And it can feel overwhelming sometimes, to be honest. So really, the key is that one step. There is that old joke, how do you eat an elephant? Well, one bite at a time. So how do you start up a ketamine clinic? One step at a time. And the key really is progress. Someone once said the definition of success is the progressive realization of a worthy goal, meaning one step, one step, one step, one step. And if you do that, 1,000 times, you've gone quite far. So even though it may feel like there's so many things to do, we highly encourage just doing one thing at a time, one step at a time, knowing that it's building the building, adding another brick layer to the foundation of the clinic.
Which brings us to our last best practice, number 13, expect challenges and lean into them. There are challenges you're probably already facing now. There are challenges that they're not even in the horizon. It's in the horizon, but you don't even see it. There's clouds in the way and whatnot. When we started, there was a ketamine shortage that occurred, and we were scrambling to find ketamine. And there's been other challenges. We're this little fledgling clinic, and then there's a pandemic. And then you wait 6 months, 18 months, there's going to be another controversy with ketamine therapy, with ketamine, the medication itself, or some new legislation or something comes up that's going to rattle you, instead of having it cause you to be reactive or to be scared or to question what you do, just lean into it. Let it be an opportunity for growth, because these are times that really are going to help you figure out if you're on the right path with this. And if it's, if you've done this from a heart-centered place, you are going to be strong. You'll be able to weather this.
Yeah, we can't change, anything in the future. There's a lot of uncertainties in life. You know this as one of the fundamental laws of life. But the thing we can control is how we act up towards them. What is our own internal reaction? So know that there will be challenges. Know that you can face them. And by knowing this, it kind of makes it nice because you're like, yep, it's going to be challenging. It's going to be hard. It's voluntary adversity. And think about the end goal. So it's really important that the challenges, to be aware of them, you're going to lean into them. And here's like kind of a little bonus is if someone else doesn't know that they're going to have challenges, and let's say they want to open up a clinic next door or, a few miles away from you. Well, if they're not necessarily expecting that, then they may not open it up. So in a way, the more challenges there are in opening up the clinic, it creates almost like a moat or a barrier for another clinic to open up. Because if someone's like, oh yeah, this is just going to be easy money, I'm going to retire, I'm going to work 4 hours a week and make it really easy and XYZ. Well, that's not the reality of it. But now if you know that the reality, yeah, this is going to be hard, this is going to be challenging, and I'm going to embrace them, that makes your skill set, that makes your clinic even more successful.
Thank you so much for listening to our podcast. The 13 best practices we share today are insights we developed through running our own clinic since 2018. We hope this episode provides valuable information to help you navigate challenges and better serve your patient. If you enjoyed this episode, we'd love it if you'd subscribe to our podcast on your favorite platform. If you haven't already, and if you're feeling generous, a 5-star review on your platform of choice would mean the world to us. It'll help us reach more thoughtful, entrepreneurial, medical professionals like you. Thank you again for tuning in, and we'll see you in the next episode.